So we've been talking a lot about the different types of biopsies, targeted versus random, and all these new developments. But what's really exciting is that with imaging coming along so nicely in the last few years, we can talk about leaving the biopsy out of the picture altogether. We can simply rely on our imaging and PSA levels to determine if there's a significant problem. And this, of course, avoids a lot of the problems, the discomfort, the risk of infection, and other issues that are associated with doing biopsies. So how can we simply leapfrog over the biopsy question, or the need for biopsies? And the answer is that we can trust that imaging is going to be able to see high-grade disease. Historically, we've relied on these random biopsies to detect high-grade disease. But now that we know that imaging studies are 95 to 98% accurate for finding the presence of high-grade prostate cancer, we can simply do an imaging study, and if it doesn't show any high-grade cancer, we don't need a biopsy. This is something that is, of course, quite revolutionary and quite exciting. Now, what about that 2 to 4% chance that an imaging study could miss high-grade cancer? And the answer to that is, of course, that patients should have ongoing PSA testing, and if there is a continued suspicion of underlying abnormality that may have been missed on a previous scan, then subsequent scans can be performed 6 to 12 months later to see if there is something brewing or growing. The good news about prostate cancer is that these small tumors typically won't spread until they get to a certain size, and that gives us the luxury of monitoring with sequential scans over time. So every man with an elevated PSA then isn't required to undergo a biopsy. They can simply have a scan, and if the scan shows no abnormality, then they can safely rely on that information. The technology to image the prostate gland with multiparametric MRI or color Doppler ultrasound is quite accurate and useful, but there are several caveats. The right technology is necessary. 3 Tesla MRI. We also need to have good technicians that are performing the scans. And of course, most importantly, physicians that are specifically trained in how to read these scans. Unfortunately, there are doctors out there doing scans that don't know what they don't know. And they will provide a scan, they'll give you a report, but upon review, my expert review of some of these reports, the scans are really suboptimal. So when doing prostate scanning, at least as of 2013, it's important to use selected facilities, centers of excellence that have specialized in getting optimal information.